Caregivers are often overwhelmed by the number of new skills they must learn, and often they must learn these skills by trial and error. But more experienced caregivers and health professionals have already developed these skills, and by tapping into their store of knowledge, your role as a caregiver will become easier and more beneficial for you and your loved one. Helping your loved one with hygiene is a large part of caregiving. Bathing is often the major activity in the patient's daily routine. People generally feel better after a bath or shower, and it provides exercise, which stimulates circulation. A bath is also a good time for you to check the patient from head to foot for any changes that should be reported to the doctor or nurse. Helping your loved one with the highly intimate task of personal hygiene may be difficult and uncomfortable for both of you in the beginning. You may initially feel embarrassed. You may feel frightened, sad, angry, or confused to see a parent or other loved one in such a dependent position. And the person receiving care may have similar emotions. These are all common feelings, and in time, they will be overcome.
Sometimes we have a son who's taking care of a mama, and he's doing an excellent job, but he can't change mama. He cannot give mama a bath. There are some female caregivers who are taking care of males, but sometimes it's very difficult for that father to let that daughter bathe him. And those are issues that, sometimes families can get past them, and sometimes they can't. And if that's a problem, find a way, to get around that issue.
Encourage your loved one to do as much as possible to meet their own hygiene needs, even if they prefer to remain more passive. Encouraging a more active role gives your loved one a sense of independence and dignity, and it also saves your time and energy.
I have liquid soap, and I put the liquid soap on the washcloth, and he scrubs himself. And he gets clean. But I want him to do as much for himself as he can. I don't want to take all of his freedom away from him or his rights, what things that he should be doing.
Some patients will need a complete bath while in bed, either on a temporary or ongoing basis.
Older people do not need to be bathed as often as we once thought they did. And so a lot of people enter into that thinking, oh, mother has to have a bed bath every day, or daddy has to have a shower every day or something like that. Well, that's not true. And in fact, that's probably detrimental to the skin conditions, particularly of an elderly person.
Some days you may only need to bathe the patient's face and any soiled areas. However, mouth care should be performed every day. Remember, hygiene is an aspect of caregiving where you should be flexible in your expectations and approach. As you gain experience and practice, you'll develop your own ways of doing things as you discover what works best for you and the patient. In some cases, you may only need to bring the necessary items to the bedside and leave the patient alone to bathe. However, most patients on total bed rest will need help. A home health care nurse may be able to help you bathe your loved one. Ask about this possibility. It does help, though, to learn the basic principles and steps involved. There are 4 fundamental guidelines to follow when giving someone a bed bath. First, make the bath a comforting experience for the patient without overtiring yourself. Second, always begin bathing the cleanest areas first and leave the dirtiest areas for last. Be sure to change the water and washcloth after cleaning any areas that might contaminate or reinfect the patient. The third guideline is to use the bath to stimulate the patient's circulation and promote exercise and activity. The bath may be the primary physical activity for a bedridden patient. To promote circulation, the caregiver should wash in long, smooth strokes. Don't massage the patient's calves, however, because this can dislodge blood clots that are more likely to form in bedridden or very ill patients. Finally, observe the patient for any changes that need to be reported to the nurse or doctor. This includes how the patient seems to feel, especially if they can't communicate clearly. Now that we've reviewed the basic guidelines for giving a bath, let's go over the step-by-step process. If at all possible, bathe the patient near a sink. fill the basin halfway with warm water that feels slightly hot to the touch, about 120 degrees Fahrenheit. The water will cool to a comfortable temperature of 110 to 115 degrees by the time you're ready to use it. Also keep in mind the safety of you and your loved one during the bath. Assuming the patient is using a hospital bed, be sure to raise or lower the level of the bed to a position that's comfortable for you. This prevents strain on your back, arms, and legs. You'll also want to use the side rails to ensure the patient can't accidentally roll off the bed. Position the patient in bed in a semi-sitting position, either by raising the hospital bed to a 45-degree angle or propping the patient up with pillows or a foam wedge. Now, to make a bath mitt from a washcloth, place your hand in the center of the washcloth. Fold each side of the washcloth across the palm of the hand. Now, fold the top of the cloth over the palm and tuck it under the edge. Now you're ready to wash the face, starting with the eyes. Dip the washcloth into plain water without using soap, which can irritate the eyes. Clean the eyes by wiping from the inner corner to the outer area. Use a different part of the washcloth to clean each eye. Gently finish washing the rest of the face using plain water. Now it's time to use soap to wash the neck and behind the ears. Use bar or liquid soap to lather the washcloth, or add a no-rinse soap to the water. Do not leave the bar of soap in the basin, and don't put regular liquid soap in the water unless you use another basin of water for rinsing. If you use bar or liquid soap, be sure to rinse well. Then pat the washed areas dry with a towel. At this time, check the eyes for any sign of drainage or redness that may indicate irritation or infection. Check for yellow discoloration of the eye. Note any changes in the patient's ability to track your movements with their eyes. The pupils should generally be equal in size and react to bright light by becoming smaller. Notify the doctor or nurse immediately if the pupils do not react to light, or if one eye appears to be dilated and fixed in size. Also, any drainage from the ear should be reported. When washing the neck, look for changes in the size of the lymph nodes in the neck. Also notice the facial muscles. Does the patient move both sides of the face in an even way, or does one side droop? Begin the patient's mouth care by placing a towel across their chest. Wet the toothbrush and apply a small amount of toothpaste. Now gently brush the teeth, cleaning the upper and lower teeth and the tongue. After brushing, help the patient rinse using a glass of water and a small emesis basin. If the patient can swallow but has difficulty taking sips of water, squirt a little bit of water into the side of the mouth using a small plastic syringe without a needle attached, of course. Ask the patient to spit the water into the emesis basin. If the patient has a hard time swallowing, clean the teeth and tongue with a washcloth wrapped around your index finger. Wet the washcloth with clean water from the glass. Apply a small amount of toothpaste and clean the teeth and tongue. Remove the toothpaste and suds using the rinsed washcloth. Now use dental floss to clean between each tooth. Wrap the ends around the index fingers of each hand and gently work the floss between each tooth. Then ask the patient to rinse. If desired, you can also use a lemon glycerin swab or flavored toothette to give the mouth a pleasant taste. If the patient has dentures, remove the upper and lower plates and brush them using a stiff brush and toothpaste. A towel placed on the bottom of the sink will help protect the dentures if they're dropped. If the patient is going to sleep, soak the dentures overnight in a cleansing solution in a closed container. Rinse the patient's mouth while the dentures are out. Check for bleeding gums, broken or loosened teeth, sores, lumps, or white patches. Notice any change in the patient's ability to swallow or follow your directions. Shaving is also a part of regular hygiene for both men and women. To prevent cuts or electrical hazards, use a battery-operated electric razor and follow the manufacturer's instructions. Begin the rest of the bath by lowering the head of the bed or repositioning the patient comfortably. Unfasten the patient's gown so it's ready to be removed. Next, cover the patient with a top sheet and a clean cotton bath blanket. Reach under the bath blanket and pull out the top sheet so the patient is covered only by the bath blanket. While holding up the bath blanket as a drape to avoid exposing the patient, the caregiver can remove the patient's gown. Place the wash basin on a towel on the bed and dip the patient's hand in the water. Use the washcloth to wash the hand closest to you. Make sure you clean between the fingers and under the fingernails. Using long, smooth strokes, wash from the wrist to the upper arm. Rinse and pat dry the patient's arms and hands. Repeat the same procedure to clean the opposite hand and arm. Apply lotion to each hand and massage with short upward strokes starting at the fingertips. Stroke each hand several times from the fingers to the wrist. Then massage the arms with long, smooth strokes extending from the hand to the top of the arm. Remove any excess lotion with a towel or tissue. Afterwards, apply deodorant. Note any stiffness, limitation in movement, or pain in the arm. Also note any change in the way the patient holds their hand, especially if it's difficult to extend the fingers or if the patient forms a permanent fist with the thumb tucked across the palm. Check the elbows and arms for any redness or sores. Check under the arms for hard lumps, rashes, or redness. Now it's time to change the bath water and washcloth. Fold down the bath blanket and wash the chest and stomach. Carefully clean the patient's navel. If necessary, rinse the chest and stomach with a washcloth. Then dry the areas well and apply lotion to the skin. Now cover the chest and stomach with the bath towel initially used to drape these areas. Observe the skin for any discoloration, redness, sores, or rashes. Also observe whether the patient is breathing evenly and quietly. Check to see if the patient's stomach seems swollen or painful to touch. Report any changes to the nurse or doctor. Now check the color of the patient's lips and fingernails. A bluish discoloration may indicate the patient is not getting enough oxygen. Some patients, however, develop a bluish color when they're chilled, so after the bath, check to see if the color change persists once the patient's body temperature is warmed with blankets. Next, place a towel lengthwise underneath the patient's leg. Then bend the patient's leg on the bed and place the foot in the wash basin. Wash the leg from the hip to the foot using long, smooth strokes. Then wash the foot, paying particular attention to the toes and heel. Rinse, then pat the leg dry with a towel. After rinsing and drying, apply a small amount of lotion while supporting the foot in the palm of your hand. Use the thumb of the other hand to massage the sole of the foot. Then start at the top of the foot and massage in small circular motions across and then up each side of the foot. Now it's time to change the water and washcloth and repeat the same steps with the other leg. Be sure to notice any limitation in the movement of the leg or any sign of pain. Check the calves for any signs of swelling, redness, or pain and report these signs to the doctor or nurse. Be gentle when washing or applying lotion to the calves to avoid dislodging any blood clots that may have formed. Check with your physician about the extent of your patient's risk. For the next part of the bath, help the patient onto their side facing away from you. Make sure the opposite side rail is raised and place a towel along the patient's back, tucking it just under their side to protect the bed from getting wet. Now wash the patient's back, working from the shoulders to the lower back and thighs. Then thoroughly rinse and dry all areas. Check the skin for any sign of irritation, color change, or sores. A reddened patch over a bony prominence, such as a hip bone, or a persistently pale area may indicate the beginning stages of pressure ulcers or bed sores. Report any sign of a pressure ulcer to your doctor immediately. Now you're ready to give a back massage. Massage toward the shoulders with long, smooth strokes. Massage the muscles along the side of the spine with gentle circular motions. Note any areas that are tender to touch, especially in the lower back. The last part of the bath involves washing the patient's private areas.
We're almost done. We've got one part left, and of course that's your private area. Let me tell you how I need for you to do it since you're able to. If you weren't able to, then I would do this part for you, but this is how we'll do it. I've got fresh water over here. Okay. And what I'm going to do is just take this towel, and I'm going to dip both ends in the water. Now, but I'm going to put soap on one end and leave the other one. So we're going to have a washing in and a rinsing in. Okay, I'm going to put soap on this end. Get it all lathered for